to the family of the boy who was deceased as of Friday evening. It's particularly hard to lose anyone, and it's especially tragic when we lose the life of a child. And especially in this case where we're dealing with disease that is relatively new, it just heightens everyone's concern, and wanted to acknowledge that. I also wanted to acknowledge the prompt response of everybody involved in dealing with providing assistance and help to this child. Everyone from his family to the Fairbanks North Star School District and the school nurse, to the folks, the medical providers at the hospital in Fairbanks, the medical providers in Providence. Everybody acted so promptly to do everything they could to assist this child, and I wanted to acknowledge them. Over the past couple days, we've been really actively involved with many different partner organizations in investigating this case, making sure that we knew everything that was going on, and making sure we had all of the information we needed so we could be sharing that information with the public. And I wanted to acknowledge especially the Division of Public Health staff who've been working throughout the weekend, and our partners at the Department of Education and Early Development. The Municipality of Anchorage Health Department has been involved with us, the State Division of Homeland Security and Emergency Management, Providence Hospital, Alaska Native Tribal Health Consortium. There have been many, many partners who've been working with us over the past couple of days as we've been investigating this case. I'm going to go ahead and turn the podium over to Dr. Beth Funk. She is a medical epidemiologist with the State Division of Public Health, and she's going to provide kind of an overview of this case and an update on information that we've gathered just in the past few hours.
Good afternoon. I'm going to sort of start from the beginning to make sure that we all understand the sort of the same situation, and then give you just a brief update on that. The section of epidemiology within the Division of Public Health, the Alaska Division of Public Health, received a call on Friday evening from Fairbanks Memorial Hospital, the charge nurse who was working that evening, to report that they had a 10-year-old boy who had been medevaced from Fairbanks Memorial Hospital to Providence Hospital in Anchorage earlier in the day. This child had been previously healthy. On Thursday morning had gone to school as usual. However, around noontime had become ill, and the school nurse had contacted the child's mother that he had a fever and cough and had complained of chest pain. The child then was seen by Fairbanks Urgent Care Center and was evaluated, was treated for pain control, was given a prescription for Tamiflu, an antiviral agent, and was sent home to recuperate. The child did not do better, continued to worsen, and early in the morning, a little after midnight on Friday morning, the child was taken to Fairbanks Memorial Hospital, where he was admitted. His medical condition deteriorated through the day, and he became confused and less responsive. His oxygen level in his blood deteriorated, and they made arrangements in the later afternoon to transfer him to Providence Hospital. He was transported, and at the time that he arrived at Providence Hospital was severely ill, was requiring major resuscitative efforts, which proceeded for several hours and was pronounced dead at about 10:30 on Friday evening. We, as you know, then yesterday gave a press release for this basic information, but at that period in time, we only knew that he had a positive rapid influenza A test. We didn't have confirmation as to what type of influenza, or if he indeed did have influenza. However, through our laboratory here, our state laboratory here in Anchorage, and the medical examiner's office, we were able to get specimens to run definitive tests, what we call PCR, or polymerase chain reaction testing, and received a report from our state laboratory at about 1:30 this morning that it was positive for novel H1N1 influenza A, which is also called swine flu. So we have confirmation that this child did indeed have H1N1 influenza. We, in the process of investigating this child's story, also learned that another child about the same age had been transported from Fairbanks to Providence Memorial Hospital, I believe on the same day. That child has a rapid influenza A test as well, and good news is that that child is doing well, and Dr. Monsager might want to speak more to that. We also have information of a 11-month-old that, again, Dr. Monsager might want to speak to, who was in the hospital for a prolonged period of time in July, had a lot of other medical problems, did have a rapid test that was positive for flu A, and did have confirmation that of a positive H1N1 through PCR testing, or definitive testing method. That child recovered well enough to return to home, but then had to be readmitted recently and died in the hospital as well. And we are still not certain how influenza A may have played into this 11-month-old's death, and are investigating that currently. And I think I'll stop at that point and see if there's any questions about what I've just run through.
Dr. Funk?
Yeah.
This is Dave Donaldson in Juneau. Was there any connection between those two kids this week in Fairbanks? Or were they like the same school or anything?
Not to my knowledge, but again, we're going to need to do a little bit more footwork on that. But no, there hasn't been any indication that there were any direct links between these two children.
What school did the second one go to?
I don't know.
Did the first child who died, did he have previous health issues? It sounded like he had a rather rapid deterioration in health.
Yes, he had a very rapid deterioration in health. We have no information that he had any underlying medical problems. And talking to one of the physicians at a healthcare facility where he had been seen, it had been 2 years since he'd been in there, and so we would have to say he was a previously healthy child.
Is that normal to see that rapid of a deterioration?
No, it's not. It's very unusual, and we are not aware of any other situation in Alaska that has, been like this severe and this rapid. However, we've been in touch with Centers for Disease Control and Influenza branch, and they have informed us that this is indeed a very rapid course, but they are aware of other situations that are very similar to this around the country. It's an unusual presentation, but it's not unheard of.
Is that alarming to you guys?
Anytime a child dies within a day and a half, it's very alarming.
I'm just wondering, I don't know if you could address this now, Dr. Funk, but with people in Alaska who have become very ill and been hospitalized from H1N1 but who have not died, what can you tell us about them in terms of how many were previously healthy, how many had underlying health conditions, how many, because we had spoken last night and you had mentioned about maybe there was a secondary bacterial infection. So wondering what other clues you can give us as to what might be happening to make some people get so ill.
That's a good point. Thanks for reminding me of that. One of the things that our CDC contact mentioned